Okay, hello students. So we will be looking at the anatomy of the muscles of the gluteal region. As I told you, it is a slightly easier to visualize these muscles if you look at in a 3D app, right? So this is one of such apps. Now this is the anterior view. You can see this muscle which is taking origin from the right iliac fossa. This one would be which one? When I tap on it, the name of the muscle will come. You can guess it. Yes, this one is the iliacus, right? Okay. And these are the muscles of the medial compartment. This one you can see is the adductor brevis. Then there is adductor magnus. Adductor longus has been removed in this one. Anyhow, I'm just showing you some muscles which we have already covered. This one would be gracilis, and right. So, and on the left side we see this one is pectineus, right? Okay, and this one should be adductor longus, correct? So these we have already covered. Now we go to the posterior aspect, the structures that you have seen today in dissection, right? So what we see here is in the midline, first of all, the bony parts we will see. This bone is the sacrum. Let us give it a lightish color, very light green, right? So we can demarcate. Now look at sacrum from the anterior view. This bowl shaped area, right? You can see this in the center of your screen, this bowl shaped area in front of the sacrum, and behind, if I show you from the posterior aspect. Yes, now we are looking into this bowl from the top, right? This is the pubic bone, the pelvic surface of the pubic bone, so that is forming its anterior wall. We are looking at it from behind. Whereas if I rotate it, now we see in an anterior view, the sacrum is forming its posterior-superior wall, and on either side ischial tuberosities and the obturator foramen covered by this muscle that you see in green color. I have given this muscle a green color. This one is the obturator internus, right? Same here is on this side as well. This is obturator internus, right? Now have a look from the inferior view. This obturator internus is divided into two parts by these muscles. These muscles, they form something called as the floor of the pelvic cavity or the pelvic diaphragm, right? They take origin, the anterior most part is taking origin from this part of the bone, but can you see this white line? This white line. This is a thickening of fascia on obturator internus from which these muscles of pelvic diaphragm are taking origin. Now, so this whole is the pelvic diaphragm, right? On this side as well. It consists of various muscles: puborectalis, pubococcygeus, iliococcygeus, ischio-coccygeus, right? Ischio-coccygeus is technically considered as separate from pelvic diaphragm, but for all practical purposes, it is forming this concave floor of pelvic cavity. Now have a look at the obturator internus from which aspect? Let me make another muscle transparent. Let me make this muscle transparent, totally transparent. So now you see that obturator internus, which extends from here to here, this is the vertical extent of obturator internus. From it, the muscles of pelvic diaphragm are taking origin. So obturator internus forms the lateral wall of pelvic cavity also, whereas the area below the pelvic diaphragm, now we are having a look from below. This area, this diamond shaped area from here to here to here to here to here to here, and eventually ending at the pubic bones anteriorly. This coming back to the sacrum. This diamond shaped area is the perineum. So above the pelvic diaphragm we have the pelvic cavity, whereas below the pelvic diaphragm this entire area is called as perineum. So your obturator internus is forming the lateral wall of the pelvic cavity in this area, whereas it is forming the lateral wall of perineum also in this area. Now look at what happens to the fibers of obturator internus. They are going backwards and then they turn by 90 degree after passing through which notch or which foramen? This area, this is the area of the lesser sciatic notch. I wish I had a mouse pointer with which I could just delineate this area. So you can see from above, you can see what is happening to obturator internus. First the fibers go backwards and then they turn here and then they insert here at the rough area above the this trochanteric fossa, right? Now you see two ligaments. One is this one covered in light blue or teal blue. I don't know what shade this is. Like I will call it light blue. And then there is the darker one. This one is in the darker shade of blue. The larger one in light blue, this is sacrotuberous ligament, and the smaller one is the sacrospinous ligaments. Now you can see that it is converting the two notches, right? This is the area of greater sciatic notch, this is the area of lesser sciatic notch. These have been converted into foramina, and what comes out from the greater sciatic notch, which is the largest component of greater sciatic notch, this muscle which I had made transparent earlier, this is your piriformis. Where is the piriformis coming from? Now you can see sacrum. There are the 5 pieces of sacrum. This is number 1, then number 2, number 3, number 4, number 5. Right, from the middle 3 pieces, that is number 2, number 3, number 4. On either side, let us look at the right piriformis. It is taking origin. Then from inside the pelvic cavity, you can see it is exiting via this area, the greater sciatic notch, and then from the posterior aspect we see it has exited, and where is it inserting? At the apex of the greater trochanter. You can see this is the greater trochanter from interior aspect, from posterior aspect, right? So piriformis is coming from the front of sacrum and inserting over this thing. So if this muscle contracts, what kind of movement will it produce at hip joint? You think about this. Then obturator internus, we have seen it takes origin from, actually there is, if I make this muscle transparent, will there be obturator membrane will be visible? Yes. Now you can see that membrane which is closing the this shiny area. This shiny area, although the app is calling it as obturator internus because I have not deleted the muscle, it is just almost transparent 100%, but the shiny area closing the obturator foramen is the obturator membrane. So obturator internus takes origin from the inner aspect of obturator membrane. Let us make it opaque again, and then it exits via which foramen? The lesser sciatic foramen, to insert into the rough ridge above the trochanteric fossa on the medial surface of greater trochanter. And here you can see the two gemelli, superior gemellus and inferior gemellus. Superior gemellus takes origin from upper part of lesser sciatic notch, or you can say the lower part of ischial spine. Inferior gemellus takes origin from lower part of lesser sciatic notch or upper part of ischial tuberosity and inserts along with the tendon-obturator. And this muscle, now you can guess, this is the adductor, the quadratus femoris. So that takes origin from the lateral border of ischial tuberosity and inserts into quadrate tubercle and the area of intertrochanteric crest below the quadrate tubercle, right? Okay. And from ischial tuberosity, you can see that all the muscles of posterior compartment of thigh are taking origin, that is biceps femoris, then there is semitendinosus, and then there is semimembranosus. All of them take origin from this area which is your ischial tuberosity, right? And then if I add nerves here, then you will be able to see that yes, I thought that it was not recording, but it is, thankfully. Let us try adding nerves here. So lot many nerves are added. Now which one can you identify? Number 1 is this thickest nerve, which is the sciatic nerve, not the inferior gluteal. that is lying just superficial to it. This one is the sciatic nerve. So that is emerging beneath the piriformis. Now you know why we study. Now it is emerging where is sciatic nerve forming. Let us give it a color. What color should I give it? Let us give it a blue. Has been repeated so many times. Some shade of green. Although green, you should never use green color to draw nerves. Okay, we cannot see the root value of sciatic nerve. Basically, so you see in front of the piriformis, this is L4 and L5. This is called as the lumbosacral trunk. It is, I just tapped on the wrong nerve. This is obturator lying lateral to it. This one I'm saying, this one is the lumbosacral trunk formed from L4, L5. Then this is the S1. Then this is S2, and then this is S3. So these all unite together to form the sciatic nerve. Will it show that green color? No. So eventually, it is starting this green color just when all of these have united and come outside. So sacral plexus is lying just in front of the sacrum here in this area, right? And so the sciatic nerve is coming out. Medial to it, this should be the posterior cutaneous nerve of thigh. Yes. And along also inferior gluteal nerve. Then one of the nerves of the pin structures, two nerves you are seeing. One is the pudendal nerve and another one is nerve 2 obturator internus. These are forming inside the pelvic cavity from the sacral plexus only, exit through the greater sciatic foramen, wind around this part of the sacrospinous ligament and the ischial spine, and then they enter perineum. Now you can see, if I give the pudendal nerve some different color, let us give it a pink color. Will we be able to see where? Yes, here you see this is the formation of the pudendal nerve inside the pelvic cavity. It is leaving the pelvic cavity below which muscle? The piriformis muscle, via the greater sciatic foramen, because it is above the sacrospinous ligament. Okay. Then it has exited the cavity, stayed in the gluteal region for this much distance. Then where has it gone? The area below the pelvic diaphragm, that is, this area is your perineum, right? So it has entered directly into perineum. Similar such structures are the nerve 2 obturator internus. See, this has also, if I give this another, let us give it a lighter shade of pink. No, we won't be. Let us give it a shade of purple. Yes. Again, if we look inside the pelvic cavity, here you can see the formation of the nerve 2 obturator internus. So it is forming inside the pelvic cavity, and if we go behind, it exits the pelvic cavity, enters the gluteal region for this much distance, and then via the lesser sciatic foramen, just like the pudendal nerve, it enters the perineum. Here you can see it is going on the deeper surface of which muscle? Obturator internus, and that is how it supplies the obturator internus. And along with obturator internus, it will supply the muscle lying above obturator internus, which is your superior gemellus, right? Okay, let me know if looking at this model made things easier for you or more difficult for you.